Hi, everybody. My name is Taylor Spaziani, and I'm the Denver Director of Operations here at the Sexual Health Alliance. Today, I'm here with Dr. Snyder. Dr. Snyder is an Associate Clinical Professor of Psychiatry at the Icahn School of Medicine at Mount Sinai in New York. His practice is entirely devoted to sex and relationship issues. He's been a frequent guest on major media, including NBC Today and the Goop podcast, and a regular contributor to Huffington Post and Psychology Today. He's written for the Times of London, AARP, Reader's Digest, Brides Magazine, and New York Magazine. He's been interviewed in the New York Times, The Atlantic, Elle, Cosmo, and Vogue, among many others. And in 2012, he hosted Dolce & Gabbana's international launch of their new fragrance, Desire, in St. Petersburg, Russia. In 2018, Dr. Snyder was awarded the Nautilus Gold Book Award for Relationships and Communications for his first book, Love Worth Making: How to Have Ridiculously Great Sex in a Long-Lasting Relationship. Women's health guru Christine Northrup called it, hands down, the most practical, fun, and empowering book I've ever read on how to have a fabulous sex life in a committed relationship. Dr. Jennifer Ashton from ABC's Good Morning America wrote, "Love Worth Making does for sex therapy what Hamilton did for the Broadway musical." This playful yet profound book reminds us that sex should be easy and can be once we learn to get out of our own way. So it's an honor to have you here with us,
Thank
Dr.
you.
Snyder. Do you want to start by telling us just a little bit about yourself and your career?
Sure. I'm a doctor, which is a little unusual in the sex field. Most sex therapists are not doctors. And I'm a psychiatrist. I became a psychiatrist after medical school. Didn't really like it very much because I didn't really like giving pills to people. And just really wanted to talk to people. And then somebody said to me, you know, you can be a sex therapist. And I thought, you're kidding. You can do that for a living? I was just right there. You know, it took me no time at all. I haven't looked back. It's basically all I do.
Mm-hmm. Yeah, I totally agree with that. When I heard about sex therapy,
Oh, God.
that was
Yeah.
my mission. Well, great, awesome. Well, to get to know you a little bit better, do you want to tell us maybe some of your top 3 bucket list items?
Okay. First on my bucket list, before I hang up my spurs, would be to contribute to the current dialogue in the field about gender. You know, a couple of decades ago, people used to talk about male this, female that, how men and women sort of are different in certain ways. Now that's become kind of out of fashion. Now people talk about ending the gender binary, blurring the gender binary, alternative sexualities, and so forth. I have a feeling we've overcorrected based on the people I see in my office for whom gender and their experience as a gendered individual is a profound part of who they are. And I really do, it's unfashionable to say this, feel that most straight men and women in my office almost come from different species. And although there are exceptions, I really can predict fairly reliably how men and women are going to feel about certain issues just based on their gender. You don't hear this. It's become very unfashionable to say this. So it's become more fashionable to say, you know, we're more alike than we are different. What I'm going to talk about in my presentation at the Sexual Health Alliance, and I hope I don't get killed for this, is how some ways in which the genders really do tend to be different. Obviously, there are exceptions, but there really are differences, and these differences are so important to think about and recognize. So that's one thing I'm going to have on my bucket list. My second great dream is to help end the divide between couples therapists and sex therapists, because there's such a divide and they don't really know about each other's work. Most couples therapists say, I don't know anything about sex, and refer to a sex therapist, which is a terrible idea because these people are already in treatment and it's not that hard. My mother is a couples therapist. She's 87 years old next month, and she's still in practice. And at one point, she wanted to refer me a patient for a sexual problem. I said, Mom, you could do this. It's not that hard. And so I taught her how to do it. She's really pretty good at it now. So I figure if I could teach her, I could teach anybody. In order to do that, though, you have to make it simple. A lot of ink gets spilled these days. And again, I'm a bit of a contrarian. I won't get killed when I talk at the Sexual Health Alliance. But a lot of ink gets spilled talking about how sex is complicated, and you have to consider all these factors and the this and the that and the spiritual and the emotional and the psychological and the so forth. Yeah, that's all good and well, but when you actually have a patient in the office, you have to focus. So one of the things we're going to talk about is how to focus. How to focus was really essential, where you really need to go, and it's really not that hard. So we're going to talk about some practical techniques for just clearing away all the complexity and making it simple. Now, maybe I'm biased in this regard because I'm a doctor, and we doctors people come to us for, certain kinds of situations. I'm also probably a little bit like this because I'm a man. We men tend to think a little bit different. We kind of want to cut to the chase sometimes. So this is going to be a little bit of an alternate viewpoint, I think, for most people who've done sex therapy training of any kind. And that's really it. I'd like to think more about gender before I hang up my spurs. I'd like to do something about the couples therapist, sex therapist divide. And I'd like to do that by emphasizing what's simple about being a sex therapist.
Wow, yeah, that's really profound, and thank you so much for sharing. I'm really looking forward to hearing more about this at our
can't wait.
So, being in the field, what is some of the worst advice that you've heard clinicians in our field give out?
Okay. I have to really think about this one because there's so much.
Mm-hmm.
One of the way this book is the only book I've written called Love Worth Making. It begins with my daughter in 6th grade, and they're going around the room asking what everybody's parents do for a living. And my daughter says, he's a psychiatrist. And her best friend sitting behind her says, he's a sex therapist. And at that point, the class explodes. And after all the hubbub dies down, one shy kid in the corner goes, what does he do? And so the 6th graders, they wonder a lot about this. And I write in the book, what I do mostly is I listen to people talk about bad sex. And I'm sure you have the same kind of experience. Most of what you do as a sex therapist, you listen to people talking about bad sex. And a lot of the bad sex that people have is because they've been given bad advice. And there's scads of bad advice. There's scads of bad ideas that are out there. Let me just run through my basic list. The first is that you should be working on your sexual relationship. I don't know what this even means. I've been a sex therapist for 30 years. I don't know what it means to work on your sexual relationship. One of the things I talk about in my book is that the sexual mind is basically infantile. It's like 2 years old at best. It just wants to feel good and eat ice cream and everybody go, yay. It doesn't really understand what work even means. So that's garbage as far as I'm concerned. The second thing is that in sex, it's very important and quintessentially important to be generous, to be a generous lover. I think this is also totally wrong. Obviously, some degree of generosity is important. However, in the 21st century, the bigger mistake that people make is trying to please and serve and take care of and pleasure their partners and ignoring their own needs. So I always tell patients, passion is selfish. And the reason it's selfish is because the sexual self, as I mentioned, is never more than 2 years old. It doesn't understand generosity. It just understands what it wants. And frankly, for most of us, that's very hot. When you're with a partner who's really, really into you and really, really turned on and is just absorbed in their own pleasure within reason, that's erotic. I have an unending line of women come into my office who are talking about how their husbands and partners just want to do this and do this and do this and do it this way and do it that way. And they're worried, does this feel good? Does this feel good? And they're just boring them to death. So the second thing would be that you have to be generous. The third thing would be that it's about pleasure at all. You hear all this stuff in sex therapy about what kind of pleasure. I don't think sex is really about pleasure. I think it's fundamentally about regression to a 2-year-old level. And when people regress and become more childish and get out of their adult heads, that's what people usually mean by great sex. When a couple comes into my office, if they're doing well, I want to hear a few giggles. So it's not really about pleasure at all. The next thing is it's really not about orgasm at all. Most people, if they remember the greatest sex of their life, they're not remembering the greatest orgasm of their life, because who can remember what those feel like, and they're so short. What they're remembering is they got really dumb and happy for a significant period of time, and it just took them someplace special. Okay, maybe they had an orgasm, fine, it's fine. But we don't make such a big deal of it. I joke in my book that one good definition of sex therapist is the only person in the world who doesn't care about orgasms, because everybody else is so hopped up about orgasms. And the final thing is the concern about orgasms is just one example of a general thing that you should always avoid in sex and in sex therapy, which is trying to pursue a goal. You never want to do sex for a reason. You never want to do sex to make your partner be appreciative or love you or have an orgasm or get hard or get wet. Those things really, really diminish a sexual experience. You really just want to be purely there, paying attention, as the mindfulness folks say, in the present moment with as little judgment as possible, and let it take you wherever it's going to take you. So those would be my main bad advice that I find myself just furious about most of the time.
Yeah, no, thank you for sharing. I think the list can go on and on forever, right? But
Yeah.
you really highlighted some major forefront points in our field today. So thank you for that. And, as you know, at the Sexual Health Alliance, we provide radical collaboration and provocative dialogue. So what does radical collaboration look like for you, and what might you want to see practitioners incorporate into their practice today?
Okay. One of the things that I'm going to only talk about one that I'd like to see practitioners incorporate is what we're going to be talking about in the afternoon at the Friday course that I'm going to be giving at the Sexual Health Alliance, which comes up specifically with regard to men a lot in treatment, but also sometimes with women, and that's neurodiversity. A lot of times, a therapist will spend months and months and months trying to understand the background, the family background, the childhood issues that might, for instance, influence the fact that a person doesn't really like to be touched very much. They come from a cold environment or something like that. Parents were unloving. They have some fears about being touched. There are a lot of people who just don't really like to be touched. Just like there are a lot of kids who don't particularly like for their food to run together, or they don't like green vegetables and stuff like that. There's a lot of people out there in the world, and they have a lot of different sexual preferences, and they aren't all psychological. Some of them are neuropsychological. People have different capacities for paying attention. People have different capacities for intimacy. People have different values for intimacy. Some people like intercourse, some people don't. It doesn't necessarily just mean there's anything wrong with you. So one thing I want to focus on a lot in the afternoon has to do with this neurodiversity and the various kinds of neurodiverse characters that we're most likely to see in sex therapy practice.
Yeah, great. That's really insightful. Like I said, I'm really looking forward to it.
Yeah, can't wait.
Well, this is your red carpet moment here. So why don't you tell the world what you're working on and where we can find you?
Oh, I already told you what I'm working on. My first book is Love Worth Making. It's primarily intended for women, although men read it too. My second book is also primarily intended for women. It's called Men Worth Keeping. And it's just in progress. And it's everything, I used to joke, it's everything my wife made me take out of Love Worth Making. It's in Men Worth Keeping.
Awesome.
So you can find me at sexualityresource.com, which is my website, or you can find me at Psychology Today. My blog there is Sexuality Today, or you can find me on Amazon. It's Stephen Snyder, MD, and my book is Love Worth Making. It's the only book I ever wrote, so it's pretty easy to find. It's just love making with the word worth stuck in the middle. And so I'm pretty easy to find.
Awesome. Thank you, Stephen. If you all are interested, please join us this upcoming weekend, August 28th and 29th, for Men's Sexual Health and Rapid Assessment with Dr. Snyder here. I'm looking forward to it, and I hope you all are too. You can find tickets on our website, www.sexualhealthalliance.com. Well, thank you so much, Dr. Snyder.
Thank you for giving me a chance to talk, and I look forward to talking to you that Friday.
Absolutely. You too.
All right, take care.